Hi everyone, so we're going to cover chapter 14 on psychoneuroimmunology. Psychoneuroimmunology focuses on the different interactions among different processes of adaptation, which include behavioral, neuroendocrine, and immunological. The immune system is a complex network of organs, cells, and proteins that defend the body against infection while also protecting the body's own cells. The functions of the immune system are to distinguish between what is part of the body and what is foreign. The other function is to attack and rid the body of foreign invaders. There are several types of immunity. Natural immunity is generalized defenses against pathogens, and specific immunity is delayed responses to a specific invader. So we both have natural and specific immunity, and different types of immune cells respond to specific types of invaders. So there are many indicators to determine whether the immune system is functioning properly. So researchers often look at the function of immune cells, the production of antibodies to latent viruses, the levels of immune markers such as pro-inflammatory cytokines, and also using more indirect measures of immune function such as how quickly a wound heals, and tape stripping, which is a less invasive procedure and involves applying an adhesive strip to the skin and then pulling it off and assessing how quickly skin barrier function recovers. A lot of research has shown stress is related to immunity in humans, and there's different kinds of stressors that create different demands on the body. And so based on the research, studies show different effects on the immune system. So there's two main principles to this. One is that different kinds of stressors require different kinds of defenses. And maximally efficient immune responses to any situation entails costs. So for example, short-term stressors raise the risk of injury. So immune system changes involved in wound repair are very likely in response to short-term stress. However, when it comes to chronic stress, this can put a damper on the immune system and lower immune responses. And so it really depends on the perception of the stressor and the type of stressor that it is. And so these are useful principles to keep in mind as we look at the relationship between immune function and different kinds of stress. With any situation, there's typically an upregulation of natural immunity parameters and a downregulation of specific immunity parameters. Our pattern of immune responses depend on whether we are faced with short-term or long-term stress. Short-term acute stressors are linked to an increase in natural immunity, so an upregulation of it accompanied by downregulation of specific immunity. Acute short-term stress is short-lived stress. It doesn't last very long. It tends to produce some stress, but again, it's not chronic long-term stress. And what we know from research is that short-term stress is linked to boosts in immune system function, whereas long-term chronic stress is associated with adverse effects on immune system function. And these effects are stronger among people with pre-existing vulnerability. So this is old age or prior disease history, or even physical vulnerability to immune changes during stress. So people have different levels of stress sensitivity. And so this can be exacerbated by a chronically stressful condition. So with short-term brief stress, there's changes in cytokine production, which prepares the body for injury during fight or flight. There's an upregulation of natural immunity, And short-term stress leads to a shift from cellular immunity and towards humoral immunity. With chronic stress, this leads to adverse effects such as downregulation of natural immunity. It suppresses cellular and humoral immunity at the same time, and it produces low-level inflammation. Autoimmunity is an abnormal response of the immune system. So it's where the immune system believes that the body's own tissues are a foreign invader, and so it mistakes the body's own tissues for something else and it attacks it. There are several autoimmune disorders that exist: Graves' disease, multiple sclerosis, Crohn's disease, and rheumatoid arthritis. Graves' disease is an immune disorder resulting in an overactive thyroid. So the thyroid overproduces hormones, which can cause heat sensitivity, weight loss, and hand tremors. Crohn's disease is affecting the intestines, small and large intestine. So it's an autoimmune disorder in which the body is attacking its own intestinal walls. So the immune system is attacking whatever's in the intestine, causing inflammation and ulcers to form onto the intestine. So according to the allostatic load model, which we talked about earlier on in the semester, stress causes wear and tear on the body, including the immune system, and it can increase our vulnerability to infectious disease. Among people who are already sick, stress predicts more severe illness and a higher production of cytokines. So it can exacerbate already existing inflammation. Negative affect is also another health risk of the immune system. So depression has shown to be associated with decreases in cellular immunity, prolonged inflammatory responses, delayed wound healing, and sleep disturbance. Studies have also found that interpersonal relationships affect immunity. So, for example, they have found that bereavement, loneliness, attachment style, marital disruption, and caregiver burden are related to changes in immune function. So, for example, some studies have shown that lonely people tend to be more immunocompromised. They tend to have more immune problems compared to people that have social support and interact with others more. People with insecure attachment style, such as being avoidant or having anxious attachment, tend to show lower cell cytotoxicity. Partner violence is related to adverse immune changes, and the stress of caregiving creates adverse effects on wound repair, natural killer cell function, and reactions to the vaccines. Coping has a protective effect on immune function through social support, finances, and optimism. Social support buffers against adverse immune changes in response to stress. Finances can limit deterioration in immune function, so people that are less financially stressed have better immune systems, and people that are more optimistic have a more positive perspective. This tends to have an important influence on psychological distress and immune changes. Personal control is also linked with immune function. So people considering stressors as uncontrollable tend to show greater adverse immune effects compared to people that see stress as a controllable aspect of life, something that they can change. Factors that are responsible for beneficial effects on immune system function include prioritizing goals and emphasizing relationships, personal growth, and meaning in life. Psychological interventions can help improve immune function by muting the effects of stress on the immune system. There was a study done on elderly participants, and they were assigned to one of three conditions. Some received a relaxation training condition, some received social contact, and then some did not receive an intervention. Participants that received the relaxation training had significantly higher levels of natural killer cell activity after the intervention compared to baseline. So this pattern can suggest that there's some enhancement of cellular immunity associated with relaxation. Relaxation interventions also appear to promote wound healing and reduce illness severity and intensity. HIV infection and AIDS originated in Central Africa. There was a high rate of extramarital sex, a lack of protection, and a high rate of gonorrhea, which facilitated the spread of the AIDS virus in the heterosexual population. Medical clinics were trying to reduce the spread of AIDS and in attempting to vaccinate people as much as possible against common diseases. Needles were used over and over again, promoting the exchange of fluids. The first case of AIDS was diagnosed in 1981 and caused by the human immunodeficiency virus known as HIV. The HIV virus attacks helper T cells and macrophages in the immune system, and so it can be transmitted through the exchange of bodily fluids, especially semen and blood. Among drug users, needle sharing can lead to the exchange of bodily fluids that spread the virus. Among men who have sex with men, exchange of the virus has been tied to sexual practices. In the heterosexual population, vaginal intercourse is associated with the transmission of AIDS, with women more at risk than men. And the likelihood of developing AIDS increases with the number of sexual partners a person has had and with the number of anonymous sexual partners. So following transmission, HIV can grow pretty rapidly within the first few weeks of infection. Typically, within 2 to 4 weeks after somebody's infected, they'll get flu-like symptoms. They'll have a sore throat, fever, chills, night sweats, and muscle aches, and swollen lymph nodes. HIV infection progresses through stages if left untreated. At stage 1, a person develops acute HIV infection. So after the first couple of weeks of being infected, HIV grows pretty rapidly throughout the body. The infection is spreading, and the level of HIV in the blood is high, which greatly increases the risk of HIV transmission. A person is highly contagious, and they develop flu-like symptoms of fever, headache, and rash. If they don't seek treatment, it will progress to stage 2, which is the chronic HIV infection stage, also known as clinical latency. So after 3 to 6 weeks, the symptoms go away and they become asymptomatic. The viral growth slows down, but it's gradual at this point. So HIV is still continuing to multiply in the body, but at very low levels. At this stage, HIV is starting to compromise the immune system now by killing off helper T cells, making a person more vulnerable to other infections. If left untreated, it will progress to stage 3, which is the final, most severe stage. And so because HIV has severely damaged the immune system at this point, the body cannot fight off infections. And so stage 3, a person is highly vulnerable to other infections and illnesses. The viral load of HIV is high because it's spread at this point through many areas of the body. And once a person is diagnosed with AIDS, if they don't seek treatment, people typically survive about 3 years. Treatment for HIV is antiretroviral therapy, which uses a combination of antiretroviral medications. This treatment reduces sexual transmission if initiated early, and drugs need to be taken regularly in order for them to be effective. An HIV diagnosis can have a significant psychosocial impact on a person's life. Depression, bereavement, and thoughts of suicide commonly accompany an HIV diagnosis, especially for people with little social support and who feel stigmatized for having HIV. HIV is a highly stigmatized condition, which can cause internalized stigma for many people, and people that have the infection experience a negative self-image. There are interventions that can help combat HIV stigma, and they help reduce depression, so they can be very beneficial and improve people's quality of life. Non-disclosure of an HIV status or lying about risk factors is a major barrier to controlling the spread of HIV. People with strong social support networks are more likely to disclose compared to people who don't have strong social support in their life. And disclosure can have several benefits. So, disclosure can open up communication and intimacy. It can open up opportunities to share information with others and for others to receive more knowledge and information about HIV. And so, the benefits include receiving more social support for longer term issues of treatment. People also experience more positive health consequences when they disclose to others. And some studies have shown that people who disclosed had more CD4 cells and helper cells than non-disclosures. The majority of women depend on social service and Medicaid to survive, and resulting depression can worsen HIV. Poverty is also a barrier to treatment adherence. Many women make drastic changes to their lives to make it better. Interventions to reduce the spread of HIV infection include getting tested, refraining from high-risk sex, using a condom and not sharing needles, and also educating people. So the role of education provides a lot of benefits. Educating the target population about risky activity can reduce the spread. Providing information about HIV infection and modes of transmission, addressing false beliefs about HIV, and being culturally sensitive. So including interventions that can be tailored to the person's cultural background also tend to fare better and reduce the spread. HIV prevention programs are developed for adolescents to warn them about the risks of having unprotected sexual intercourse. And the goal is to help adolescents instill safe sex practices to reduce the spread of HIV. The stage model of behavior change guides interventions to increase safe sex practices. And interventions that are effective tend to address the norms surrounding sexual activity. And so, including more interventions like these that can address some of the norms about sexual activity and expectations during adolescence can be helpful. Cognitive behavioral interventions can be effective for a person suffering from HIV. It's a guided framework for many interventions. Stress management programs are implemented to improve people's mental health and quality of life with HIV. CBT can be directed to health behaviors for HIV diagnosed people that have poor health habits. Cognitive behavioral interventions can be applied to reduce risk-related sexual behavior to prevent HIV. It can also be helpful for maintaining adherence to treatments and reducing viral load. Some psychosocial factors have shown to affect the course of HIV infection. So, for example, some factors that increase disease progression are having negative beliefs about the self and future, depression, stress, trauma, and psychological inhibition. Factors that tend to decrease disease progression are optimism, active coping strategies, and some personality traits of extroversion and conscientiousness. Spirituality has also been linked to decreased disease progression as well. Interventions with IV drug users need to be targeted towards reducing contact with infected needles and also changing sexual activity. So reducing risky injection practices can include giving people information about AIDS transmission, also implementing needle exchange programs, and instructing people how to sterilize needles. And so all of these things can reduce the risk of AIDS transmission. Methadone maintenance treatments that are coupled with HIV-related education can help reduce the spread of AIDS by reducing the frequency of injections and shared needle contacts. It can also help reduce health risk behaviors by increasing the use of condoms and by reducing the number of sexual partners. People with an HIV infection also face a lot of psychosocial challenges because the HIV infection is a chronic illness and it's not acute. There's a lot of psychosocial issues that can come into play. So people can be out of work, and so they need interventions to help them return to work. There's also HIV stigma, so people often feel stigmatized for having their condition, and they have to cope with the fear, prejudice, and some discrimination that they can encounter from the general community, which can increase psychological distress and create a lot of mental health issues such as depression and anxiety. So coping skills can be effective in dealing with HIV status. There's coping effectiveness training, where the person learns to perceive that they have control over stressors in their life. There's some research showing that written disclosure can actually help reduce stress. So good coping skills are essential, and they can have a more positive influence on the HIV infected person. There's also mindfulness-based stress reduction, which is helpful managing psychological distress that is associated with an HIV status. Positive affect promotes good HIV care and adherence to treatment. It also helps predict low likelihood of risky sexual episodes. Social support in HIV is tied to greater treatment adherence and lower viral load. Support from family helps prevent depression in HIV. The internet is also an important resource for coping. So those that use the internet to help manage their HIV status typically are more knowledgeable about their HIV. They have more active coping skills and they have more social support than those who do not use the internet.